Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Virender Sodhi, Shailinder, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 AM, radio that listens to you.
Hi folks, this is Dr. Virender Sodhi, and I'm very excited to be on the radio Desi 1250 AM, and the title is Your Body is Your Natural Pharmacy. This is very important for you to understand that we make every damn medicine on demand. Body is an amazing healer. It can create diseases, but it can also cure diseases too. And that is the whole purpose of this program, to teach you how to heal your body naturally without the toxic effect of drugs. And today I have in the studio with me my younger brother, Dr. Shailinder Sodhi, and his lovely wife, Anju Sodhi. So I'm going to ask them to just introduce themselves, and then I'll carry on and we'll break in between. You can call in also. The number is 844-301-1250. Again, the number is 844-301-1250. You can call in and we will take your questions, and if you have any difficulties in your healing process regarding your health, we'll be very happy to answer those questions for you. And keep that in mind, those are for only experimental purposes. You still have to see the consent of your doctor, and if you are seriously sick, you want to talk to your doctor about the healing process too. So I'm going to introduce my brother, Dr. Shailinder Sodhi.
Hello folks, this is Dr. Shailinder Sodhi. Like Dr. Virender mentioned, this is a radio show where we will be coming every Saturday from 1 p.m. to 2 p.m. and please feel free to call us on this line for any of your questions. We are basically Ayurvedic and naturopathic physicians, and we have a clinic in Bellevue, not too far from Seattle area, and we see all type of patients at our clinic. So, but we will be addressing different subjects every Saturday from 1 to 2 p.m. I'm very excited, and I hand over this microphone to my lovely wife, Dr. Anju Sodhi, to let her introduce what her specialty is, and then we'll come back to Dr. Virender again.
Hello friends, this is Dr. Anju Sodhi, and I'm very happy to be on this radio show today with my husband and my brother-in-law, and excited to talk to you and taking your questions, and we'll be able to answer some of your questions and how to treat the body with the natural way. Thank you.
So your body is your natural pharmacy. You know, you might have seen then when we get little cuts or abrasions, your body heals naturally. And that's very obvious to us. You see it in front of your eyes. But everything, your heart can heal, your lungs can heal, your kidneys can heal. Different organs take different times. For example, skin takes around 6 to 7 days to heal. And you can see it, and it's very quick, and so you can obviously witness it. But your bones take 6 weeks to heal. And, that's why the doctors put you in cast for 6 weeks. And that's the minimum time it takes to heal that bone fractures. And if your liver has a condition, it takes around 6 weeks for the liver to heal. If you have a heart condition, it can take up to 3 months to 1 year to heal your heart. Similarly, if you have a nervous system condition, it can take 3 months to 1 year, but body heals. Previously we thought in the medical science that the nervous system doesn't heal. Now that has been all proven wrong. We know that body heals, and it's the amazing ability of the body. We're still trying to learn the whole process. It's not a crystal clear science yet. There is so many things which we don't know about this science, but amazing part is that body has been doing for millions of years, and we are going to keep it doing for millions of next years, because the body itself is a pharmacy. It can heal our bodies very naturally. So one of the things is I have been in practice for 36 years. I did my MD in Ayurvedic medicine in India in 1980. Then I migrated to USA in 1986 and went to Bastyr University and became the naturopathic physician. And I became the first Ayurvedic and naturopathic physician in the whole country. And I established Ayurvedic and naturopathic clinic first in Edmonds in Seattle area, and then later on I moved to Bellevue. And since 1990, I've been practicing in Bellevue, and we see many different kinds of patients, most of them very chronic patients. And I was seeing so many cancer patients in my clinic that I decided to go into oncology. I did a fellowship in oncology with Dr. Mark Rosenberg, and since then we've been seeing so many cancer patients. But that's not the only thing which we do. We have heart patient, blood pressure patient, diabetic patient, rheumatology patient, endocrinology patient, and phenomenally, these all people get phenomenally good results. And this is not to put down the allopathic medicine. I think they have a wonderful place. If you have a broken bone, I don't think you want to come to us because you want to get it fixed. But if you have a chronic diseases, we are not doing the best what we need to do. I just want to put you some very interesting statistics. This is a paper published in Medscape just on May 3rd. The third leading cause of death is pharmaceutical drugs and hospital errors. And this is published in Medscape, which is a very prestigious medical journal, and just published on May 3rd. Actually, I've been saying that for many years. The number one cause of death is a heart disease. Number two is cancer. And number third is pharmaceutical drugs and hospital errors. So are we doing something wrong? Is there any room of improvement? What is wrong? We all need to think about it. And what has come to my understanding after practicing 36 years, that we need to take responsibility for our health. The doctors cannot make you healthier because you're with the doctor for only 30 minutes maximum. And if you're lucky, because in today's world, not many doctors are spending even 30 minutes with the patient. Most of them are spending 5 to 10 minutes. And when you're not with the doctor, he does not understand you fully. You understand yourself fully. And it boils down to your lifestyle. First of all, you have to have a good thought process. If you don't want to get healthy, nobody in the world can make you healthy. And then comes to your lifestyle. If you're not eating the right kind of food, it's the example I use this for my patient is like you can have wonderful, beautiful car like a Bentley or BMW or Mercedes, and you put a wrong fuel for one day, your car is done. It's completely destroyed. So, but look at us. What we are eating today, we never ate that in the history of mankind. The fried food, the fast food, the pesticide, the insecticide, the preservatives, frying of the food, basically, it was never done before the amount of scale we're doing right now. I tell my patient that there's no frying pans on the trees. Do you see any frying pans on the trees? If you don't see the frying pans, that means we are not supposed to eat that food. So those simple things will heal us if you follow the laws of Mother Nature. And the second thing is air. We are supposed to breathe every second. We breathe around 16 to 18 times per minute. And that's the free medicine. When you breathe, your whole body gets oxygenated. You get full saturation of oxygen. When you get full saturation of oxygen, you are healing. Your body is wonderfully doing all the function it's supposed to do. Then the water. Most of us, we don't drink enough water. We are dehydrated. The cells are clogged because they need a fluid to move through the toxic stuff and the good stuff. So if you're dehydrated, you're not going to get better. So these simple things, stress reduction, getting good quality sleep, exercise will help you heal. And this is basically what you need to do. You don't have to depend on the toxic drugs most of the time or even supplements or herbs because these will help you, but they are not going to fix you. Who fixes is you. That's why I kept the title, Your Body is Your Natural Pharmacy. You can heal when you want to heal.
So Dr. Virender, is like a question is like a lot of our listeners right now probably hearing this. When we talk about your body's natural pharmacy, they need to understand that body has amazing mechanism, amazing way to, heal ourselves. So it's not the drugs which heal us, it's our body and our thought process behind it, which really is a healer. So would you please a little bit go deeper into this subject?
Yeah, so again, as I said, the body naturally heals. Like when we get a skin cut, we see it, the body puts in specialized cells and it removes the inflammation, then it fills in the specialized cells to stitch you, and you get actually your skin gaps are healed and you start to heal, and in 7th day you barely see that wound. But when we put things outside, from the outside into the body, for example, a chemical, basically it masks the symptoms. You're not getting it cured. You are basically stopping the process, but body wants to have naturally. So what heals you is those processes which we just already talked about. The thought process. If you want to get better, then you will heal. The food, the stress, the water, the air, and getting a good quality sleep. There is one interesting study which I've been quoting a lot lately, that when people walked in the mother nature, for example, in the jungle, like we have a very beautiful northwest here, and when people walked for once a week for 1 hour, their body got healed, and they had a immune system bumped up 40%. I don't know any drug which can do that. So it's very simple, very easy to boost your immune system by just walking in the mother nature. Again, there is no drug which will boost your immune system by 40%.
So in a way, actually, what we are saying is that your thought process, if you want to send a positive thoughts to your brain and to your mind and to your body, you have amazing this healing process. Body thinks that way, that you are healing yourself. But it's the same way when we start thinking, I'm sick, I'm not feeling good, you really feel that down. And that is very common in our, at least the patients I've seen, a lot of these people say that they don't feel good, and that's the message they are continuing to send to their brain, and they really don't feel good. And then on the other side, I have seen the very sick patient who comes in with a positive attitude. They think, we are getting better every day, we are improving, and their healing process is different, and their response is different. Why do you think that's the case, Dr. Sodhi?
So, again, it depends upon, I became a doctor because I wanted to become a doctor.
Right.
So if you want to go to Portland and you take a road to Vancouver, BC, where are you going to end up? You're going to end up in Vancouver, BC, not in Portland. So the thought process is very important, and you want to align it. If you don't align your thought process, and one of the interesting part of Ayurvedic medicine is it talks about what is the purpose of life, and it has a Vedic philosophy, so dharma, artha, kama, moksha. Right. Dharma means religious satisfaction, and again, the religion does not mean going to a church or mosque or temple. It's your responsibility towards the universe. And then the artha, financial stability. We all need to have some financial stability. And then the kama is procreative. We produce like ourselves, and which is very important function of any living organism. Look at it. The sperm count of a male has reduced tenfold in the last 60 years. The egg quality of a female has deteriorated. Not many females are getting pregnant. If you go to the fertility clinic, you'll see the lines of these infertile couples, because they are not have the same quality of eggs and the sperm because it has deteriorated.
So what do you think has contributed to this, Dr. Sodhi? Because I see that quite a bit in fertility clinic, in fertility patients in our clinic. So, and, I have worked with these couples where I have approached in a very natural way to, enhance their quality of sperm and also the ovum in the females. But why do you think that's happening?
So again, I think one of the interesting factors in early days, the female used to get married earlier. So the egg qualities are more better when they're younger. And most of the girls are going for higher education, like, my nieces, my daughter-in-law, all are, very highly qualified. They all are doctors. And so by the time they become physician, they're 27 to 30 years old. But the egg factories start to deteriorate by the age 33. And your egg quality is deteriorating constantly from there. So that's one factor. But other factor is environmental factors, pesticide, insecticide, toxin stuff, and the food qualities, and the lack of exercise. So all those things can be, really detrimental for the fertility.
So, it's basically what we are seeing is it's the environmental factor, and it's also our physiological factors as aging, so our people are, like you mentioned, are becoming more, educated, and they're trying to put attention to their profession. So they're delaying the process of procreation, or they're having the kids, and that's one of the factors which is a really factor for infertility.
Yeah, that's one of the factors. Then other one is the food quality and the toxic load. So I think there is a caller who's calling. We'll take this call on the line. Hello, this is Dr. Sodhi.
Yeah, hi, Dr. Sodhi. This is Anuj from Bellevue. So
Hi,
I have
Anuj.
a question regarding. Yeah. So I have a question regarding, let's say, like ear infection. So these days, like kids gets ear infection from swimming pool, or maybe the summers are coming, they will go to beach, and because of the water, they can get the ear infection. So what we can do to prevent or to cure it? So since, like you said, like the body is like a self pharmacy. So is there any home tips which we can apply to rectify it, or like how we should react to the ear infection?
So, Anuj, this is a very good question. We see a lot of patients with the chronic ear infections every day. One of the reasons why kids get a lot of chronic ear infection is food sensitivities. So people don't understand that, is you had a food sensitivity. You're sensitive to mostly the major culprits are dairy, milk products, wheat product, the orange family, the nightshade family, which is like a potato, tomato, bell peppers, and the pesticide, colors in the food. They are the main cause of the problem. And sugar, a lot of we feed sugars to kids, and when they eat a lot of sugar, you are actually incubating this bacteria in your body, and they can inflame the middle ear. And then because in the middle ear has a opening which opens up in the mouth on the second molar, and that get plugged up, and then people has infections. So basically, what you can do is, you can do some hygiene. What that mean, in older days, you may have remember from your background from India, your grandma used to put some ear drops in your ear, which is called Karnpurna, or you put some oil in your ears. And previously, even the ENT doctor used to discourage it, but now they're saying, yes, you should put some oil in your, drip some oil in your ears, and that's very effective and very healthy. So you can put it, and then you do lymphatic drainage. What that means is you go on the sides of your neck and massage it. There are lymph glands, which are a detoxification process in our body. They help to detoxify our body, and you drain them so you don't get plugged up. Basically, it's a mechanical defect. As the kids are younger, the eustachian tube, which opens up in the mouth, is not as developed, and they go on developing ear infection. But these infections can also be in adults too. And in those cases, is most probably is due to the food sensitivity. So giving antibiotic does not help it, but you have to watch your the diet what you're eating, and the antibiotic may be some value, but it does not give the permanent fix. And if you have a very high fever, and if you have excruciating pain, then you maybe want to take it. But most of the time, you can do massage, you can do some hot packs on it, and this will help it. And you watch the diet, and maybe come and see some naturopathic doctors, and they will help you, especially if you have a chronic ear infections.
And the other thing I think, Anuj, you need to remember is if the ear infection is secondary to some sort of upper respiratory infections, then we need to address that as well. Ear infections are usually indicative of some sort of a compromised immune system. So, focusing the immune system in the children is very, very important. And you can do by doing a proper diet and getting a counseling on nutrition and what are the things you can do. And, also if the child is prone to get ear infections, especially if they are going to swimming pool, like you mentioned, they get the ear infection. Remember to get those plugs for the ears, and that simple prevention will take care of that as well, along with all the good recommendations which Dr. Virender has mentioned.
Thank you, Anuj, for you. Do you have any other question?
No. Thanks for your reply.
Thank you, Anuj. Alrighty, so we're gonna continue with the our talk on the Your Body is a Natural Pharmacy. So one of the interesting thing is that if you look at what is killing America right now, the number one is the heart disease. And I pulled out some statistics. The number 5th most sold drug, actually number 4th, is statin drug Crestor. And statin drug has been introduced since 1978 in the world, and the mass production has been since 1987. And billions worth of drug has been sold. The Crestor's sale is around $14 billion per year. And but do you see the reduction in the heart disease? That's the biggest question we have. So Crestor is one of the statin drugs. There are many like Lipitor and other drugs too. But they have not shown the results which we want to see, cutting down the heart disease. Now, we used to blame that if you eat saturated fat and you are going to have heart disease. That concept has been now pulled down, and we are saying the saturated fat has no link with the heart disease. This has been published in the mainstream medical journal. So, complete 360-degree change in the thought process has come. What causes the heart disease is maybe inflammation, maybe many other factors. Stress is one of the most killer. So in my clinic, we see a lot of patients who has been on these statin drugs, and we are able to reverse the heart disease without giving those statin drugs. Body, again, is a natural pharmacy, and the cholesterol is not the problem. Cholesterol is a wonderful thing for your body. It gets only problematic when you have inflammation. So if you can keep the inflammation down, just to tell you that cholesterol is that much important, because every hormone in the body, all your estrogen, your progesterone, your testosterone, your cortisols, all are made by the cholesterol. So if that is that bad, the body will not manufacture it, because body has the wisdom. It's not going to make bad thing if you're in balance. Again, if you're out of balance, you're going to create a problem. And the another interesting statistics about the drugs is there's a drug called Abilify. And that Abilify is used for depression and psychosis. It's the #1 selling drug right now. It's a more than $60 billion worth of drug is sold. So you can watch, wow, what is going on? Is our society becoming sicker? Is getting psychotic? Is getting depressed? That much drug is used? And this is #1. The second one is a Humira, which is sold for more than $50 billion. And this is sold for Crohn's disease and rheumatoid arthritis. And again, these are, we call them TNF alpha blockers, which is the inflammation molecules which get blocked. But again, you have to be on these drugs for the rest of your life and has lots of side effects. Another drug is Nexium, which is for the reflux, the gastrointestinal reflux or heartburn. Again, lots of side effects. And then the Crestor we already talked about, and the Enbrel, which is another TNF alpha blocker. So I can, if you look at it, so many drugs are sold for multi-billions dollars, and the results, as I said, the third leading cause of death is pharmaceutical drugs and hospital errors. So are we doing something wrong? Do we need to change? This is the question we all need to put to ourselves. What we can do to improve our health. Again, these drug molecules are not going to heal you. You know that, we know that, and
they probably provide the just temporary relief, but at the end, like you mentioned, your body is your natural pharmacy. So if we provide the right environment and do the right things for your body does heal. Isn't that right, Dr. Virender?
That's right. We have seen in so many patients, like one of the patients came to me, and he had a coronary artery disease, and he was hospitalized. He had a heart attack. He got the stent in, and he was put on the standard protocol. You put on statin drug, you put on a beta blocker, you put on diuretic. He was put on a blood thinner to help the whole process. And when his blood test came, he has a low cholesterol to begin with. His cholesterol was under 60. So he doesn't need Lipitor, but he was still put on the protocol. Mm-hmm. And then when he challenged and why he was put on the cholesterol, because that was a protocol, right, which everybody gets on. So he said, I'm not satisfied, Dr. Sodhi, what you can do. So it's okay, let's look at your whole picture. So we ordered a test, which is called C-reactive protein, which measures the inflammation. We ordered another test, which is called homocysteine, which tells you if you have a issue with the methylation. Methylation is a detoxification process, if your body can detoxify, and his homocysteine levels were elevated. So when we treated him 9 months later, we gave him the nutrition guidelines. Okay, these are the food which you need to eat. You need to avoid these food, and you need to do exercise, you need to do yoga, you need to do breathing exercise. We also did a detoxification program, which is the Panchkarma program, which is a very famous Ayurvedic program. And 9 months later, his heart all cleaned out, and he didn't need to be on any drug. So, but Dr. Dean Ornish, I think in 1989, first published the data that people with the changed diet, with the exercise, with the stress reduction, with the yoga, can reverse the heart disease. Originally, I think he took 13 patients, and out of 13 patients, one died, 12 reversed the disease, and one who died, he was an attorney by profession, and as you all know, attorneys are a lot of under stress, and he was in a divorce situation, which is another stress, and Dr. Dean Ornish want them to walk, and he was jogging. Jogging is not the best for everybody, And in my clinic, actually, I discourage people to jog. I ask them to walk, and walking is one of the best thing which you can do.
Usually brisk pace walk.
Yeah, and you can do intervals. You can do normal walk and increase the pace and then come down back again. So again, I think the body is amazing pharmacy. It will do what it needs to do. You don't have to ask it to do. It naturally does it.
Right.
And but what do we have to do? We have to put our own things which we need to do, like nutrition, stress reduction, exercise. Like exercise, if you do excessively, you have a problem too. And if you don't exercise, then you have a problem too. Same thing if you get not a proper sleep at night. And that sleep has to be at night. It cannot be in the daytime.
And sleep is such an important factor in everybody's life. I think people do not understand how important it is to have great sleep when we are addressing the cardiovascular issues from high blood pressure to heart diseases. But it's interesting you brought the Dean Ornish study, and our president, Bill Clinton, he turned it around. I mean, this guy went through all the surgeries, different. And now look at him. He has lost weight from his presidency days to now. And one of the things which he did was his diet improvement.
Exactly. He followed the vegetarian diet, and from a food junkie, he became a healthy junkie. He started to eat more plant-based diet, and is actually phenomenally turned around from having couple of heart surgeries and not getting fixed and all the drugs. And now he actually also consulted Dr. Dean Ornish, by the way,
right.
And he changed his diet into 360 degrees, and now he's looking very healthy and is going around with his lovely wife all around for the presidential candidate, and which is very stressful, and you can all see. You can call in if you have any question. The number is 844-301-1250.
And we are doing Your Body is Your Natural Pharmacy on Desi 1250 AM. I'm with Dr. Virender Sodhi and myself, Dr. Shailinder, along with my wife, Dr. Anju Sodhi. We all are the practitioners at Ayurvedic and Naturopathic Medical Clinic in Bellevue. And we have been in practice over 30 plus years. And Dr. Virender is one of the doctors, and along with me and Dr. Anju, we all see all type of patients. So if you have any question, please feel free to call us at 844-301-1250. And with this, we would like to take a commercial break, and we'll be back in 30 seconds.
Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Virender Sodhi, Shailinder, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 AM, radio that listens to you.
Hi folks, this is Dr. Virender Sodhi again, and in the show Your Body is Your Natural Pharmacy. This morning we had a very good fortune of having a breakfast with one of the very unique and very illustrious scientists of Bastyr University, Dr. Liana Standish and Pam Snyder, Dr. Pam Snyder. And Liana Standish is the naturopathic oncologist, and she's a researcher. She has PhD, and she is a naturopathic doctor. She's an acupuncturist. And we had a phenomenally good, talk with her. And she was saying that Ayurvedic medicine is such a wholesome medicine, and it really appeals to her. And we just had a wonderful blast with that session with the breakfast. And basically, in Ayurvedic medicine, we are not talking about giving a supplement or herb or drug. Because those are only 25%.
And it's very much individualized, Dr.
Exactly.
Virender. Like I said, we cannot put everybody in the same basket.
Exactly.
You have 10 people in the room. They all will have maybe the same disease, but 10 different reasons why they got that disease.
Exactly. So, it can be, and we have a very interesting model of body types, which we call different body types are called Vata, Pitta, and Kapha body type. And these body types can behave differently with the same medicine, with the same stimuli, from same stress. So it's very important to understand what you are and what you are doing with that. And if you don't understand your constitution or your pathology, you're not going to get balanced.
So like it's having your understanding who you are, what your constitution is, really makes a difference when it comes to the disease outcome. I think we have callers on the line. I will let you take that call, Dr. Virender.
Hi, it's Dr. Sodhi.
Hi, my name is Siddhartha, and I've been meeting with Dr. Shailinder Sodhi actually, so it's wonderful to be hearing him on radio at the moment.
Thank you, Siddhartha. Thank you.
Yeah, so I just wanted to say thank you so much for being so informative on the show. And I had one question in terms of what I'm noticing among people of my age in the early and mid-30s. You know, many of them I'm hearing are having a lot of issues with the heart problems, as you were discussing on the show. So I would like you to let me know if this is something that is more of a recent trend or if it has always been the case, and why it is happening so much to the younger generation.
So, yeah, Siddharth, thanks for the call. One thing is, there is a interesting studies been done on this subject. Immigrants of any country has higher rates of heart disease, diabetes, and overall diseases. So I think one of the factors is the stress. Because when you get uprooted from your roots, like for example, I come from India, the culture is different in US. You don't have the same kind of language, you don't speak same kind of dialect, you don't have same kind of festivals, you don't have similar kind of food habits. So that's one of the biggest factor. Then again, the exercise, lack of exercise. Most of us, the major clients we see, they don't exercise properly, and either they are doing excessive exercise or doing very under exercising. So exercise is one. Then the food habit, is crazy. What we eating? We should not be eating what we eating today. It's crazy. We should eat what the Mother Nature made for us. Mother Nature has given us wonderful tools, and if you look at it, especially in America, and now it become all over the world, the food, similar kind of food is available, like mangoes are available all year round, apples are available all year round. Do you think that's healthy? It's not healthy. So when patients come to our clinic, we give them seasonal fruits and vegetable charts so they can follow those natural law, because Mother Nature is very intelligent, design things for you. It gives things to you according to that season. And then, the not proper amount of sleep, especially if you see a lot of immigrants and people who are in IT or doctors or engineers or businessmen, they are workaholic. They're working 12, 13, 14 hours a day, and they have very less time for the stress reduction for their own body. And when you do it, you're going to have a lot of problem. And one of other thing, which especially in the immigrant population, is diabetes. A lot of people are diabetic or pre-diabetic, and which leads to around 4-fold increase in heart disease. And the diabetes is the number one cause of blindness, number one cause of kidney failure, 4-fold heart disease, and number one cause of amputation of the foot or stuff. So it's really amazing that we can all reverse these things, but you have to be active about it.
The other thing is that is like, simplifying life is a better way, and also eating what Mother Nature has given, and remember to enjoy the life and taking some time out of your busy schedule. The less stress, better it is for your body, because you're producing less cortisols, and that actually is one of the factors also relating to the heart disease. If there is a chronicity, if the family history of heart disease is, we need to be careful and we need to modify our lifestyle. That's what we teach to our patients at our clinic in Bellevue at Ayurvedic Naturopathic Medical Clinic. And, it's a very good question, and I think like Dr. Virender mentioned earlier, that it's one of the number one killers in the America right now. And it is one of the things which we can work on and improve. And I think we have another one caller, and we'll take that call. In America right now, and it is one of the things which we can work on. And
Hello, I think you have the radio on. You need to get we're getting the feedback. Hello.
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 Yeah.
Hello.
Put the radio down. Put your radio down.
Hello.
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 हाँ जी बोलो.
हेलो, मैं प्रेम बोल रही हूँ.
हाँ जी हाँ जी.
मैं प्रेम बोल रही हूँ.
So it's a good listeners that you can call us in Hindi, Punjabi or Urdu, any language. So we have a caller.
मैं प्रेम बोल रही हूँ. बेटा मेरी तबीयत खराब है. कोई दवाई दो दसो.
ਹਾਂਜੀ ਦੱਸੋ ਤੁਹਾਨੂੰ ਕੀ
ਬੋਲ ਸਕਦੇ ਹੋ?
ਹਾਂਜੀ ਬੋਲ ਸਕਦੇ, ਤੁਹਾਨੂੰ ਕੀ ਪ੍ਰੋਬਲਮ ਹੈਗੀ ਹੈ?
ਮੈਨੂੰ ਤੁਹਾਨੂੰ ਕੀ ਦੱਸਾਂ, ਬਿਮਾਰੀ ਹੈ, ਸਾਹ ਚੜ ਜਾਂਦਾ, ਹਾਰਟ ਦੀ ਬਿਮਾਰੀ ਹੈ।
ਹਾਂਜੀ ਦੇਖੋ ਤੁਹਾਡੇ ਨਾ ਜਿਹੜੀ ਹਾਰਟ ਦੀ ਬਿਮਾਰੀ there ਕਾਫੀ ਕਾਰਨ ਹੋ ਸਕਦੇ ਨੇ ਉਸ ਬਿਮਾਰੀ ਦੇ, ਤੇ ਜਦ ਤੱਕ ਕਾਰਨ ਨਹੀਂ ਪਤਾ ਲੱਗੇਗਾ ਉਹਨੂੰ ਅਸੀਂ ਠੀਕ ਨਹੀਂ ਕਰ ਸਕਦੇ। ਮਗਰ ਤੁਸੀਂ ਸਿੰਪਲ ਚੀਜ਼ ਜਿਹੜੀ ਤੁਸੀਂ ਕੀ ਕਰ ਸਕਦੇ ਹੈਗੇ ਹੋ, ਤੁਸੀਂ ਬਰੀਥਿੰਗ ਐਕਸਰਸਾਈਜ਼ ਕਰ ਸਕਦੇ ਹੋ।
ਪ੍ਰਾਣਾਯਾਮ
ਪ੍ਰਾਣਾਯਾਮ
ਜ਼ਰੂਰੀ
ਕਰੋ।
ਹੈ।
ਹਾਂ ਤੁਸੀਂ ਜੇ ਬਰੀਥਿੰਗ ਐਕਸਰਸਾਈਜ਼ ਕਰੋ ਤੁਹਾਡੇ ਹਾਰਟ ਨੂੰ ਫਰਕ ਪਏਗਾ, ਬੜੀ ਜਲਦੀ ਪਏਗਾ। ਸੋ ਡੂ ਦ ਬਰੀਥਿੰਗ ਐਕਸਰਸਾਈਜ਼ that will help you tremendously।
ਇਸ ਤਰ੍ਹਾਂ ਹੈਗਾ ਕਿ ਪ੍ਰਾਣਾਯਾਮ ਨੂੰ ਨਾ ਗਹਿਰਾ ਸਾਹ ਲੈ ਕੇ ਨਾ ਪੂਰਾ ਬਈ ਤੁਹਾਨੂੰ ਪਤਾ ਹੋਣਾ ਚਾਹੀਦਾ ਕਿ ਜਿਹੜੇ ਸਾਡੇ ਲੰਗਸ ਨੇ, ਜਿਹੜੇ ਸਾਡੇ ਫੇਫੜੇ ਨੇ, ਉਹ ਇੱਕ ਫੁੱਟਬਾਲ ਫੀਲਡ ਦੇ ਸਾਈਜ਼ ਦਾ ਹੁੰਦਾ ਹੈ। ਉਸ ਤੋਂ ਤੁਹਾਨੂੰ ਆਈਡੀਆ ਹੋ ਜਾਣਾ ਚਾਹੀਦਾ ਕਿ ਅਸੀਂ ਜਦੋਂ ਸਾਹ ਲੈਂਦੇ ਹਾਂ ਬੜੀ ਸ਼ੈਲੋ ਬਰੀਥਿੰਗ ਕਰੇ, ਖਾਲੀ ਸਾਹ ਲੈਂਦੇ ਹਾਂ। So we need to learn how to do a deep breathing. The pranayama is such an amazing tool to expand the lung capacity and oxygenate the blood. Exactly. And that's the other way we can actually, prevent the heart disease as well.
Not only heart disease, almost every disease, because the oxygen is such a base of the life force. If you don't breathe more than 1 minute, we are dead. And every cell needs oxygen. So when we breathe, you oxygenate and you actually detoxifying the whole body.
Right, and that's simple. When somebody is having cardiac arrest, we are doing a chest compression. We are trying to oxygenate, so we don't want the brain cell to die, because that's the first thing which goes. So, folks, that's important. Not only learning CPR, but understanding that oxygenation of the blood cells is very important, and you can do by simple doing pranayam or deep breathing every day.
And God has given this wonderful tool, lungs, and it's all free. There's no tax on it either. So that's
it's a free medicine.
Free medicine. So okay, so one of the interesting thing is thank you for calling, Premanji. We talk about the Ayurvedic medicine. Ayurvedic medicine is almost more than 5,000 years old, and it has a tremendous history. The most of the medicine of the world learned from Ayurvedic medicine. We were the first surgeons of the world. We did amazing surgeries like plastic surgeries and the cataract surgeries and the surgeries on the fetuses, on the fractures and transplant. It's amazing that knowledge was there, and somehow it got lost. The Britishers and the Italian surgeons learned from Indian doctors in the 17th and 18th century. And then it was kind of put down by those so that the Indians cannot practice. And now we see that it's actually became a monopoly of the allopathic medicine. But it's not. This is the tradition of India. So you can see that the medicine of Ayurvedic medicine was very well advanced.
And one of the things which we this morning when we were having a breakfast with Liana Standish, Dr. Liana Standish mentioned that all these ancient healings are actually had much more depth knowledge than what we currently have.
Exactly, because it's a level of understanding may be different. We may be speaking different language, we may be speaking molecular biology language, but that does not mean that the knowledge was not there, or because we can we all speak different languages, but the meaning can be very similar. And similarly, we can speak a different language of the chemistry or physics, but the meaning will be similar, the outcome will be similar.
So folks, feel free to call us at 844-301-1250. 844-301-1250 at Desi 1250 AM. I am Dr. Shailinder Sodhi along with Dr. Virender Sodhi and along with my wife, Dr. Anju Sodhi. We are here on the show, Your Body is Your Natural Pharmacy, and feel free to call, and we will be here every Saturday from 1 to 2 p.m. With all the different topics. Dr. Virender, do you have an idea what we will be covering next week on Saturday?
So I think these days we have a lot of issues with allergies, so the next we'll talk about allergies, how to take care of allergies naturally. And
we live in very green city, lots of pollens and trees. I think that would be a great topic, folks. Yeah. So if you have allergies and anything, we will address all types of different types of allergies. It's a great topic, and it's one of the reasons why in the spring season, I think our clinic get very busy with all these allergies.
That's right. So the another thing is, does drug have a role in our healing process? Yes. Do they provide the healing? No. So now you said, why are you asking? You're saying two things at the opposite side. Because, if you need to break the cycle of a heart attack, you need an instant drug. Yes. But after that, how to heal the heart, they're not doing the job. they are actually blocking it. Like, for example, beta blocker, which is one of the drug which is used for the heart disease, or calcium channel blockers, or ACE inhibitors, or diuretics. The long-term studies does not support that they're helping the whole process. They actually are bad for the whole process. If you take it for long-term basis, they are actually worsening the disease.
Right, so it's like an emergency medicine. When you need some treatment emergency, definitely it gives you that saving, which is important to save the life. But eventually, it is you who have to take that step to prevent the future attacks and improve the cardiac health, the health of the heart, or of your any type of disease in your body.
Yeah.
So that's why we think your body is your natural pharmacy. So folks, feel free to call us at 844-301-1250 on Desi 1250 AM. And I am with Dr. Virender Sodhi. My name is Dr. Shailinder, along with my wife, Dr. Anju Sodhi. We will be here every Saturday from 1 to 2 p.m. And, for any question, any type of question, you can call us. You can call us even in Hindi, Punjabi, Urdu, or any of अपनी कोई भी हिंदुस्तानी लैंग्वेज जो भी तुसी बोलना चाहते हो बोलो साढ़े ना पंजाबी च ऐसी गल कर सकते हैं हिंदी में भी बात कर सकते हैं और उर्दू में भी कर सकते हैं तो please feel free to call us and I will let Dr. Virender carry on the topic of your body is your natural pharmacy.
So another thing is we talked about a little bit about surgeries. So does surgeries are necessary? Sometimes yes. But before you got a surgical procedure, you should take at least a couple of opinions from different people. So this is another interesting article which is published in JAMA, which is the Journal of American Medical Association, just published in April of 2016 on April 27th. And this is really actually very eye-opening journal, article. And it says that the 7%, the 7 surgeries has 80% cost attached to them and 50% mortality. So these 7 surgeries are partial colectomy, small bowel resection. Colectomy means you're cutting the large intestine. Small bowel resection means small intestine you're cutting down. Cholecystectomy means gallbladder surgery. Operative management of peptic ulcers. Simple, I think you understand that. Lysis of peritoneal adhesions. People develop adhesions most probably after surgeries or some trauma. And appendicectomy, which is very common. Leptotomy. So these 7 surgeries account for the 50% surgical deaths. And that is happening right here.
That's an eye-opener for me as well. I never thought the cholecystectomy will be involved in it.
Exactly. So it's like you can see the 7, and these all are abdominal procedures.
Exactly.
And these abdominal procedures, 50% death rate, and they have a high cost. There's 80% cost to them. So again, billions of dollars of cost attached to it, and the average procedure is around $13,000. And on top of it, the high mortality, which was shocking. And this is happening in America, not anywhere else.
Not, folks, we are saying that you don't need a surgery. When you need a surgery, you do need to have surgery done. But what we are talking about is, before you get to that point, you can keep yourself totally healthy with just adopting to the healthy lifestyle, following good diets, and just doing the right things for your body. So understanding the constitution, we talked about earlier, that knowing who you are. I mean, not by your name, but who you really are, what you have gotten from your parents. That's one of the topics we will cover in future. We have a caller on the line, and we'll put that caller on the line for Dr. Sodhi.
Hi, this is Dr. Sodhi.
Hi, this is Paras from Boston. Dr. Sodhi, great show.
Hi, thank you, Paras.
I've been listening to it since the beginning, and I know you talked about immune system and diet. And my question regarding my 9-month-old, and specifically wanted to understand, like, what as a parent we can do to help improve their immune system, especially when these toddlers are very picky eaters.
So that's a very good question because, as a parent, I think every parent's nightmare is that their child does not eat. And most of the patients who come to me and with these small young kids, and they have the same question, my child does not eat. So one of the things which we all need to learn and understand is that don't force eating your kid, because then they will have aversion to eating. If you let them eat at their own way, they will be much more.
That's the worst thing any parent can do, is just force their child to eat. I think that creates a really hatred toward the food.
Exactly. The aversion, because whenever you go with a spoon in front of them, they're going to run away from it.
I have seen that multiple times, parents doing it, and it makes me laugh that I tell, if the child is hungry, they're going to come after you and ask them to feed you. You don't have to run after a child, really.
Yeah. So the one very important as a parent is don't force feed them. Second is, believe me, that he is not going to sleep hungry. He is going to ask for the food, and that would be much better for him.
Even at the age 9-year-old, exactly. 9-month-old or 6-month-old, they will cry, and you will know that why child is crying. I mean, other than there can be other things, but if they're crying, basically they're asking for a food, and if they're taking the food, that's when you go further.
Yeah, and the another thing is, he's 9-month-old, so you can start adding some vegetables and fruits and carrots. You can also introduce some white rice. Again, although I don't recommend white rice for the general population, but for a kid, white rice is much better than the brown rice.
Yeah, on that I usually recommend start with one simple food, simple food, one ingredient, and see how the child likes it. Because remember, every child develops their taste buds, so they have to like the food, and don't make a food very complex. And start with the one single food, and that also will indicate if the child is going to react to the food or not. So that's important when introducing the solids. Isn't that important?
Yeah, that's true. And go slow, because don't introduce 20,000 things at the same time, and then you don't know what is causing a problem. And then you can introduce some lentil, like mung bean or the lentils or kala chana, but you go slowly.
And like soups are very good way to introduce to the little one. It provides the nutrition, and you can go very slowly. And be careful with the salt. Don't make food very salty, especially for the little kids. You don't want to introduce too much higher salt. So make sure it's on the low side, but not too much.
And again, the best formula for keeping your child or yourself healthy: eat according to seasons. What is available in the season, eat that food and feed that food to your kid. Mother Nature bundles up all the good immune system things for you, and it's according to season. For example, you see lots of nuts and seeds in the winter. Have you ever wondered why you have lot more nuts and seeds available in the winter than in the summer? Do you see the nuts and seeds in the summer? You don't. You see nuts and seeds in the winter.
Because that's the winter food. Exactly. So that's what it is. But also when we come to the child's nutrition, or we at our clinic, we have this policy that you must breastfeed for first year, and solids should be introduced something like 9 months or even after 1 year.
Yes, exactly. I'm the greatest. I love to tell people, give solid food by 1 year. And if you don't, just slowly start, like a white rice or soups of dal or mung beans or lentils, that kind of stuff, slow.
It's also very important, since the breastfeeding is going for a whole year, the mother has to be nutritionally doing all the right things for her. So it's a mother who should be fed really nutritional food than the baby, because baby is getting all the nutrition from the mother.
Exactly.
Child's immune system is very much dependent on mother's health.
Exactly. The child's immune system is borrowed from the mother. And as soon as the baby is delivered from the birth canal, he is inoculated with millions kinds of different bacteria, and that's how the immune system
all
develops.
The Acidophilus probiotics, the bifidobacteriums are naturally going into that. And we have another caller on the line, and I will let
Thank you, Paris. Thanks for the call.
Thank you, Paris. And I will have that second caller on the line.
Go ahead. This is Dr. Sodhi.
Hi, Dr. Sodhi. This is Sushma calling, and I'm so happy that you are giving this lecture today, and it is so informative. So I have a question for you. I would like to know, I'm running in my early 50s right now, and so what would you recommend for the women who are going through the menopausal stages?
Yeah, that's a really good question. A lot of females, has to go through their life cycle, and I think the female has interesting. They come into menarche, then they have a normal cycle, and then they go into menopausal stage, and the only females know what they go through, because as a male I can't understand that, because I don't have that fluctuation in the hormones.
And we see so many patients with the perimenopausal and menopausal symptoms, and I think this is one of the things which we teach our patients, that how to modify their diet during this phase.
Exactly.
That's a very important phase. People who are in the villages or in the third world country, they haven't heard even this type of thing. They don't even see these issues.
They have less menopausal symptoms. It's very interesting what you brought in. That's true. And they will have the symptoms, but they are very less because what they're doing they are very active. They exercise because they don't have a choice. And then second thing is they're eating healthy diet. The whole food diet is very important for the menopausal symptom. The exercise, there was a very interesting study published around 10 plus years ago. The females who walked for 1 day a week, they have more hot flashes than females who walk 2 days a week, then 3 days a week. And so, and the females who walked 5 times a week has the least amount of hot flashes. And so this is, interesting. Just walking 5 times a week, 45 minutes a day will cut down the menopausal symptom. That's a free medicine right there. And how difficult is to do. And if you cannot walk 45 minutes, start with the 5 minutes, 10 minutes, and eat natural food.
Incremental exercise
Exactly.
is important. You can do water aerobics exercise. All those are less strenuous on the body. So definitely exercise, diet play a role in menopausal, and also making sure that you have less stress in your life. Pranayam, yoga, breathing, that really helps. So folks, we are on Desi 1250 AM, and we are doing Your Body's Natural Pharmacy. I am here with Dr. Virender Sodhi and myself, Dr. Shailinder Sodhi, along with my wonderful wife, Dr. Anju Sodhi. We have our clinic at Bellevue, Ayurvedic Naturopathic Medical Clinic, and the clinic phone number is 425-453-8022, 425-453-8022. And we do take insurances at our clinic, and you can schedule your appointments. And majority of our first time office calls are not less than 1 hour, 45 minutes to 1 hour, and second office calls are 30 minutes. So we do take a complete detailed history. Isn't Dr. Sodhi also specialized in oncology? I'll let him say some.
Yeah, because we see a lot of difficult patients most of the time. So usually we end up spending a lot of time, 45 minutes to 1 hour in the first office call. And even the following calls, office calls are also that long because we're telling them what to do. And
so we are focusing on the lifestyle. We're telling you the diet. We are telling you exactly what you need to do.
Exactly.
Like I said, there's a room of 10 people. All they can have same disease, but their way of treatment can totally vary. That's a very unique thing about Ayurvedic medicine.
Exactly. If you're, for example, if you're skinny, lean, thin person and you're jogging, you are not going to have a good result. If you're a overweight people, you start jogging, you're also going to lose your knees. So you have to understand what is going on with your body.
Right. So understanding who you really are is very important, and that's what Ayurvedic medicine teaches, and that's what we are specialized in. Dr. Virender has a background in Ayurvedic medicine, and he's also a naturopathic doctor. And along with me and Anju, we both are also Ayurvedic doctors, along with naturopathic physicians. We all are licensed physicians in state of Washington. We have our practice at Bellevue, Ayurvedic Naturopathic Medical Clinic. The clinic phone number is 425-453-8022. And we will, like I said, we will be here every Saturday on Desi 1250 AM. This is our first show. And we are very excited that we'll be coming here, and we're looking forward to talk to all of you. Dr. Sodhi, so can you please repeat what is coming next Saturday again?
So for the next Saturday, we are going to talk about allergies, which is a very common problem, and especially
living in Northwest.
Northwest is a very hub of allergies, and because we have a moist weather and we have a lot of greenery here, and so we have a lot of pollens and grass. And a lot of people suffer. And also, interesting, Dr. Shailinder, is the allergies has increased 3,000 times since 1980.
I think it will be such a great topic. We will discuss all this, what might have happened during this age.
3,000 times increase. It's
That's
crazy.
Crazy amount.
Since 1980. Are we doing something wrong with it? This is very important for us to understand what is going on wrong. And on the menopausal stuff, one very interesting study was published. Again, this is a natural compound, raw honey. When the females took raw honey, 1 teaspoon twice a day, their menopausal symptom reduced around 50%. Wow, what a medicine! Simple natural medicine.
It's right in your kitchen, ladies. It's a raw honey, which you need to take a couple tablespoons a day. That's all. It does the job.
Yeah.
So, this is one of the things which we'll be covering in every show. We'll be telling you some of the tips from your own kitchen, which you can use for as your healing, because and also some of the cooking tips, what type of food you should be eating to enhance your immune system. But I'm very excited for the first show, which is almost coming to the end. And again, this is Your Body's Natural Pharmacy, and we'll be coming every Saturday, 1 p.m. to 2 p.m., along with Dr. Virender, myself, Dr. Shailinder, along with my wife, Dr. Anju. So remember to call us next week on 1-844-301-1250 on Desi 1250 a.m. at the show, which is called
Your Body is Your Natural Pharmacy. And I'm Dr. Virender Sodhi. Thanks, folks, for listening to us, and bring up your lots of questions. We're here to answer you. We're here to help you. We have the knowledge to help you. We have been doing it for 36 years, and I think this is what you need to do.
Thank you very much, folks. It's a